Hi, Dr. Shaban. Let's talk about mummy makeover, the combo of breast and tummy.
Yes.
A mummy makeover is a big surgery. Is it safe to do the breasts and tummy at the same time, or do you recommend splitting them up?
My personal recommendation is to split them up. Because if you talk about a breast surgery or a tummy surgery, it's a 3-hour surgery minimum. There are people who really push us and we do it. This body has what you call physiological function. You affect a lot of functions when you stay in theater for long. So you can imagine if I'm taking 3 hours on the breast and 3 hours on the tummy, that is 6 hours in theater. It's good actually to do one and wait a minimum of 6 weeks before you can do the other for the body to recover, because it's a big surgery. If I do a tummy tuck on you and remove something like 4 kilograms of fat, that when we multiply by 2, it's like you have removed 8 pints of blood or something like that. That is the toll it's taking on your body. So if I'm going to remove like 3 more kilograms or 2 more kilograms from the breast, it's too much tension or too much pressure on the body. Beauty should not be rushed. Beauty should be taken slow. So I would prefer we do it in 2 sessions than 1.
What is the downtime for this specific combination for a busy mom who needs to get back to lifting her kids?
If you do a combo, the tummy tuck and the breast, you need a longer time to heal. I normally say 3 months. By the way, within 2 weeks, you'll be able to lift your baby. You'll be able to even play with the baby, but you'll not be able to do the tough stuff. Okay, so the downtime of this is a bit higher. I normally give it 3 months.
Does the combination of procedures increase the cost effectiveness compared to doing them separately?
When you combine them, it's a little bit cheaper because it's one theater type. But the separate procedures actually are just the same. But on the other side, you stay longer in theater, so you may even be charged even more. So if you calculate everything, the cost may just be the same.
How do you manage pain control for multiple surgical sites at once?
Any surgery hurts the body. The more you cut, the more the pain is going. So the first 24 hours will give you very, very strong painkillers. We call them narcotics. Narcotics make you dizzy, make you groggy, make you sleepy. That is intentional. There's something we call a parasympathetic response to the body. The body doesn't respond too much with the high heartbeat, sweating and all that. So we give you narcotics for the first 24 hours. Then the second day we taper down the narcotics and build up what we call the non-steroidal drugs to now control your pain. Pain levels are different for different people. But before we release you, we'll make sure that the pain killers you go are the ones you can take at home and can be comfortable. If you need an injection to control your pain, we'll rather keep you and give you the injection and monitor you.
Will I need a drain? And if so, how long do they stay in?
Drain refers to a tube that will remove out what you call waste. When you handle someone with fat, like the breast, like the tummy, like the buttock, that fat breaks down and liquefies. If you don't give it a way to come out, that liquid will remain there and will form a lump. We call it a seroma. So we need a drain to come out. A drain should stay there for 7 days. So even if you want to go home the next day, just know I'm going home but with a drain. We will teach you on how to activate it, to empty it, how to measure how much it is. Then after that, you come back.